Right now, he's the one pregnant.
It's becoming heavy. It's kicking. It's kicking.
Oh. Oh, you're giving birth? We are going to for my ultrasound because we wish to have a child. Do we wish to have a child, or I'm the one only wishing to have a child again? Tupag. Nay, because I did an HSG treatment last March and we don't know, I don't know, but something going on in my menstruation that is not it's irregular. So now the doctor will check me again, and it's only me who is allowed to enter the hospital, I mean the clinic, because of the prevention of the infection.
So Case will just drop me there, then he will just park anything anywhere under the tree.
Yeah, not in the full sun, not close.
Yeah.
So good luck to my Dutch later. I will talk Dutch to them. Then I will just call him whenever I will have the appointment. I mean the bespreken. Yeah, bye-bye love. Tot later. But there's no lipstick. So I asked her what's the cause of the pain and the blood, and it's because of the pain because of my PCOS. Huh? That makes sense. That's what you told me.
Okay. And what can we do about it?
I don't know. How to overcome PCOS? Maybe losing weight and diet.
Yeah, that's part of it, absolutely.
Yeah. This is free right now.
Yeah.
I'm already done with my examination. I thought they will get the blood to me today, blood examination today. But what she only did, she checked my cervix. That's the she got some fluid, and then
Like a contrast fluid, or?
I will show you the photo.
Okay.
And then check the abdomen, and she also did an IE test, like she put her finger
Okay.
like that.
Yeah.
And everything is okay. It's just my PCOS. You will go alone to get the medicine.
Oh yeah. That's I think better for everyone. Dus ik ben zo terug.
Okay, it's straks.
Tot straks nog. Focus dan. We stonden op een parkeertje.
A few moments later.
So I will take first a pregnancy test, and then if it's negative, I will begin with Provera.
Yeah. Yeah, we are in the clinic right now. Also here, corona preventions. My wife's sitting there.
So I'm almost done. I already dressed myself and I'm off to go. I just had my X-ray check, and the results will be forwarded to our general doctor, and the general doctor will just call us or email for the appointment and discuss about the results.
Say then.
Hi guys, welcome back to our channel. This is Vina.
And I'm your husband, Kees.
Yeah, and to our new subscribers, welcome to our channel. Nice to meet you. And to our friends, our subscribers, thank you for still watching us. So what are we going to vlog today?
We're going to talk about PCOS.
Did you study that?
No. That's how they say PCOS.
Polycystic
Polycystic, yeah?
ovarian
Ovarian
syndrome.
syndrome. Okay.
Yeah.
No. That's what.
So that's very common nowadays with women. Even if you are slim, you are chubby, voluptuous, any woman can have. So back in 2017, I was diagnosed with PCOS or polycystic ovarian syndrome, and then we were trying to conceive. That's the reason why I'm vlogging this. It's because I have struggle of getting pregnant again in my age. So I have PCOS because I was overweight, and I am still overweight and still struggling to lose weight. So how to lose weight?
Eat healthy, exercise, all that kind of things.
Yeah. So that's very difficult, especially if you don't sweat and you keep on eating sweets. So
Correct.
I have to change my lifestyle, which I am doing it now, thanks to your love. I was checked in Davao, and then the gynecologist told me that she will put me on a program to how do you say, to balance my hormones. So I will have a fertility, something like I will have a treatment, but it needs to have you need to have your partner with you, so that whenever you follow the pattern, she will monitor if there is a progress, if you were able to produce eggs and so on. So I told her that I will be living in the country because I will move to the Netherlands with my husband. So she just gave me a recommendation for me to forward that to the general doctor that we have. So we went to the doctor, and then I showed to her the paper, and she forwarded me to the gynecologist here in the Netherlands. So 2018, so in the beginning of March, I started Clomid to regulate my menstruation. Then what was the procedure if my menstruation will be regular?
Yeah.
I forgot already. If my menstruation will be regular, then
Because you had an irregular menstruation,
yeah,
we first had to balance that menstruation so that your cycle will be in a regular way. And after that, if it will be regular, then the next step will be there.
Yeah. However, it was not okay. So I have to take the second option, which is the injection.
Yeah.
So we started injection in the beginning of September, and it was how many weeks was that? I believe it was 5 weeks. 5 weeks, because
we tried twice.
Yeah, it was every day that you have to inject yourself the same time. So we chose to inject at night because we were both relaxed. And then, like, of course, at the back of my mind, injecting yourself is really a challenge because you have that thought that it's painful. But the injection, it was just so thin. Like, mas baga pa, mas makapal pa yung karayom na ginagamit mong pantahi. It's really, really thin.
The needle.
Yeah, the needle. So, after that, I had that injection because to let my follicle grow. Because when your follicle will grow, it will produce eggs. So once it produces eggs, then that's the time that we will go to the next injecting procedure, which is the ovitrel. Ovulip was the first, and then the next one was ovitrel. So the process from the ovulip is it was so slow because we waited that my follicle will grow minimum of 18 millimeters, but mine was the progress was so slow, like 10, 12, and then 15, and then I actually had a deal with him that whenever it grows, it will be successful. You will give me Pandora. Because it's a celebration that I how to say that? Na nag-grow siya. And then we were so happy. By the way, by checking that, by checking the follicle, it was through ultrasound procedure. So every week we went to the hospital to check. So after that, we tried until it reaches 18 millimeter. Then after that, we injected the ovitrel, and that's the whenever you inject that in 3 days. In 3 days time, you have to inject that, like you have to count less than 30 seconds or 1 minute maximum. So
it's quite a while ago already, so
that's why I am recalling, because it was last 2018. So when you inject it to your tummy, you have to let it stay longer and less than a minute so that the fluid will really infuse in your tummy. And it was quite like, it was so heavy for me because it's like parang ano yung tawag dyan? Bigat sa pakiramdam. Parang hawi siya sa kaya ba? Hawi siya. Tapos, and then we were trying. We were like so excited na sana ito na. And then after it was October 28, it was before you went to UK that we had I got my period. Yeah, so it was, I was working that time. Then I felt like it was after a week, by the way. I felt like in your stomach, like para kang dinidysmenorrhea. It feels like dysmenorrhea, but you don't have blood. Then after like how many tries that I went to the comfort room to check myself, there was a blood. I got my period. So I cried. Really, like it how do you explain that? It was quite a disappointment that, you know, injecting yourself every day, every night. We tried a lot of advices that they gave us, options, suggestions, and we even tried a lot of positions. He even searched what kind of positions is best to make it like yung parang deep talaga na walang masasayang na, you know, parang ganon. You know what I mean? Pag nag-ano na kayo, nagtalik, ganon. So we stopped. I felt like, I don't know, parang ang hirap. You should really lose weight. We enrolled ourselves in the gym, but then some commitments were on the way, so we have to stop that. I had I followed some diet, but then it's difficult, especially if you're not used to it. I sit here underground. So last March,
Ik ben niet in beeld zo, hè?
okay, daar mabusya. I've undergone HSG treatment, and HSG treatment stands for
Hysterosalpingogram.
yeah, hysterosalpingogram, pingogram, like that. I cannot pronounce. So it's
an X-ray. An X-ray they will take from your ovary, your tubes actually, the ovary tubes, and they will
fallopian tubes.
Yeah, and they will inject a fluid, a contrast fluid, to see if the follicle tubes
Are
blocked or open. And if they are blocked, then you need to have surgery. And if they're open, everything is okay.
We were happy that my fallopian tubes were open, so it's one headache away, one stress away to avoid the operation for me. So it was there was a catheter. The fluid was inserted through a catheter, and then it was how do you explain that?
I don't know what you want to say.
The procedure from HSG.
Well, you go into the X-ray room. The doctor will put the contrast fluid in.
Yeah, contrast fluid.
Yeah.
That's the word, contrast fluid. And then after that, the oil. It was an oil infused.
It's an oil, yeah. They will infuse it into your follicle tubes.
Yeah, that was the painful part, because when the catheter reached onto my uterus, so they have to clean, to remove all infections or dirt. It was okay, but then the OB-GYN said the next procedure, the next step will be a little bit, you will feel pain, a little bit discomfort. So she gave me a heads up, but after that, it changed my routine. It changed my life, because up until now, I still have the pain. So it went well. The X-ray results was good. They forwarded that to my gynecologist. Then she called us for the result to be discussed. And then because of the coronavirus, you cannot go in the hospital to have it. To the clinic to have it. How do you say that? To have an appointment with your doctor. So it's more on phone calls. And then the next procedure will be I will have what was the next? I forgot, love.
Right now.
Nay, before that, before we were on and off to the hospital because of my pain.
Oh, like that. Well, first of all, you take the Provera to
regulate my menstruation.
Yes. And after that, they will do an IUI.
An IUI is?
Whenever your follicles are okay and you have eggs.
I will produce eggs.
You will produce eggs. Then they will take the semen of the man, and then they will help you with that. They will inject it into your womb, so that at least the semen can reach the egg cells, the follicles.
But before that happened, we went to the hospital. We went first. We called the doctor first because I'm having discomfort due to the procedure that I had, and then she said that I just have to take pain reliever, but the pain reliever didn't help. I have to move. I have to move, but then it's really excruciating pain. And then we called again the doctor. Then they asked me, the gynecologist, and then they asked me if I was having a fever, if I was having how do you call that, love? Leg pain. But I said there was no pain at all, only on my back, the lower back. So it's quite really annoying. It's really annoying until my period was on and off, like interval of how many days, and then it goes back, and then the cycle is not anymore normal. And the whenever I see, I mean, my period was not that normal compared to the period that I had. Like, you will feel that you will have a leak. No, it's just it won't fail the panty liner that I'm using every day, but it's constant, which bothers me. And then I had an appointment again to the gynecologist. Then she ultrasound me, she checked my cervix, it's all okay. I thought I will have a blood test for the hormones.
She said that she will have.
Yeah.
She will give me.
Yeah.
Oh, yeah, I also had a blood test done. And that was for the ovulation. And then she called. Yeah, we went to the doctor.
You didn't have a blood test yet?
We went to the laboratory, remember?
Yeah, but that was not the blood test that you
What was
are going
that?
to have.
They check if I am ovulating.
Yeah.
It was a blood test.
Yeah, that was a blood test.
If they want to see if I am ovulating.
Yeah,
Oh,
but
that was a blood test.
this blood test that will come right now
For the hormones.
is to see.
If my hormones are working.
Yeah.
That's what I mean. Diba, nalibog namin doon. Anyway, then, it was okay. Why I don't, she will call tomorrow to see if, the results of my cervix, because she checked the, diba, fluid from my cervix.
Yeah.
She gave me a Provera to regulate my menstruation. Then once my menstruation will be regulated, I hope, which I'm having right now. But yeah, for me, it's not the normal menstruation that I've had before.
So yeah, right now we have to see what the reaction of the OB/GYN will be, gynecologist, and then we'll take the next step in our way to get
By the
pregnant.
way, guys, this is the warm cushion that I'm using. So this is, by the way, electric. You just have to choose the intensity, the warmthness, like in a scale of 1 to 6. So he bought this for Lidl because Chrissy was having muscle pain. I mean, when she's having her period, she has discomfort. So you can put it here on your stomach. So since I had more pain every day, so I just use this. And most of the time, since I had a treatment, I complete bed rest. Like, I cannot do anything. Like, if I stand like more than an hour, that I will have discomfort. So yeah, this one you will use it like, how do you call it? I don't know. So this is my best friend for 3 months. So like this, you will use it like that, and then it warms here. So that's all for our vlog today, guys. It's already 1 o'clock in the morning and we're still up because he is making a Spanish bread. So thank you for watching, and for those who are for those my fellow women who are also having trouble conceiving, we can do this. I hope I also inspire you. And if you're asking about HSG treatment, you can actually call your doctor, your family doctor, and discuss it with your doctor so that they can recommend you to the OB/GYN. By the way, IVF, yeah, talking about PCOS, HSG treatment, IVF is not our option at the moment because IVF comes on the last. The doctor, the gynecologist wants us to have the minimal procedure without, how to say that, minimal procedure avoiding the IVF, because the IVF is really the last. If IVF doesn't work, then we don't know anywhere what to do. in our insurance here, we can have 3 times per year attempt of IVF. So as much as possible, if we can still have this procedure less pain and less time, so we will go for it. So thank you very much for watching. I hope you like our video. Please give it a thumbs up, like, share, and subscribe. Have a good day. Bye-bye.
Bye-bye. Doei.